Welcome to Insider Medicine In Depth. I'm Dr. Susan Sharma. There does not appear to be any benefit from routine exercise echocardiography for patients who have undergone a procedure to improve blood flow to the heart and are not experiencing any troublesome symptoms, according to research published online ahead of print in the Archives of Internal Medicine. Here is some information about exercise echocardiography. It involves exercising on a stationary bike or treadmill while the heart is examined using ultrasound technology. It helps physicians observe how the heart functions under conditions of stress. It is useful for identifying blockages in the coronary arteries. Researchers from the Cleveland Clinic Heart and Vascular Institute performed exercise echocardiography on more than 2,100 patients who had experienced a heart attack and who underwent either heart bypass surgery or angioplasty to improve blood flow to their heart. They also followed the patients for an average of nearly 6 years to see who died from a cardiovascular cause. Overall, 13% of patients were found to have ongoing problems with reduced blood flow to the coronary arteries, the blood vessels that feed the heart, based on the results of the exercise echocardiography test. Among these patients, only about a third actually underwent another procedure to improve this blood flow. Undergoing a second such procedure did not reduce the risk of dying from a coronary event. While the presence of reduced blood flow to the heart did help predict who would die from a cardiovascular cause, clinical stress testing was a much better predictor of outcomes than exercise echocardiography. We had a chance to speak with Dr. Thomas Marwick, corresponding author of this study, who offered some further insight.
So what we did in this study is to take about 2,000 people who had had a previous bypass operation or stent procedure, and we looked at the results of their follow-up stress test. So they had no pain that required a stress test. They just had this anxiety that they had they had this coronary problem and it may have come back again. And we found that, there's a fair number of those folk who, in spite of the absence of symptoms, have a positive test. I think the number's about 13%. And we found, as previous studies have found, that the presence of a positive test is predictive of something bad happening in the future. But what we weren't able to show is that those people that had a repeat stent or repeat bypass operation, that had any impact on changing their outcome. So we're able to identify risk, but at the moment it doesn't seem as though the identification of the risk, can lead to an intervention that is going to change that.
Today's research suggests that unless additional research indicates otherwise, there is no need to routinely test those who have undergone procedures to open the coronary arteries with exercise echocardiography. While the test can help identify those who might be at greater risk of having a coronary event, there does not presently appear to be anything that can be done to change this outcome. For Insider Medicine In Depth, I'm Dr. Susan Sharma.